Good evening, Mr. Rush. My name is Leanne. I'm one of the student nurses at East Georgia College, and today I'm going to be doing your health history.
Evening.
Okay, I'm going to just be asking you some personal questions about yourself, just to get a good idea of your health history. And also, if you'll just answer these questions to the best of your knowledge, and know that anything that you tell me is confidential and won't be revealed to anyone but us, okay? Okay, can we go ahead with the interview?
Yes.
All right, what is your name?
Charlie Rush.
Okay, and your age?
40.
And your gender?
Male.
What is your ethnic background?
German, Irish, and Cherokee.
Okay. What languages do you speak?
Just English.
Just English, okay. And what's the reason that you're here today?
Sleep. I'm not sleeping well.
Okay, and how long has that been going on?
For a few weeks now.
Okay, any stress in your life or anything new that could be causing that?
Just swing shift on a new job.
Swing shift on a job, okay. Is this the first time that you're experiencing this, not being able to sleep?
Mm-hmm.
Okay. What about childhood illnesses? Any measles, mumps, chickenpox, rubella, or jaundice as a child?
No, ma'am.
Okay. Any injuries as a child?
No.
Any other illnesses or chronic diseases such as diabetes, hypertension, heart disease, or mental illness?
Mm.
Okay. Have you ever been hospitalized?
No.
Have you ever had any operations?
No.
Okay. Are you up to date on your immunizations?
Yes, ma'am.
When was your last flu shot?
Last year.
Okay. Your last TB skin test?
Was last year also.
And that was the two-step TB test?
Yep.
Okay. Your last tetanus shot?
It was about 2 years ago.
All right. Your last visit to your primary care physician?
About 6 months ago.
Okay. And why did you see your primary care physician?
I twisted my ankle while we were moving.
Okay. Did they do x-rays, scans, and everything, and you went to your follow-ups? No
Mhm.
problem since then?
Just spray.
Okay. Wonderful. Do you have any allergies to medications, food, or the environment?
I don't.
All right. Are you taking any medications, over-the-counter prescription, or any herbal remedies?
Just Protonics.
Protonics? Okay. And how long have you been taking Protonics?
2 years.
Okay. Any family history of chronic diseases such as diabetes, hypertension, high cholesterol, mental illness, or cancer?
Diabetes and cancer.
Okay. And that's on your mother or father's side?
It's on my mother's side.
All right. Any other family history of asthma, obesity, or pneumonia?
No.
All right. Do you have any health problems related to skin, like dry skin, any eczema, rashes, bruises?
I don't.
Okay. Do you have any hair-related issues like dry scalp, oily scalp, any hair loss?
Mm-hmm.
What about head loss? Have you ever had head loss?
I have.
When was that?
When I was a child.
As a child, okay. Any history of nail issues, discolorations, yeast, or any fungal infections?
No.
Okay. Do you ever have any headaches or migraines?
Sometimes.
How often do you have those?
Just a few times a year.
Just a few times a year? And what do you normally do when you're having headaches?
Just take Tylenol and rest.
Okay, and that usually helps subside the headaches?
Mm-hmm.
Wonderful. Do you have any problems with your neck or swollen lymph nodes?
No.
All right. Do you have any problems hearing?
I don't.
Any ear infections or ringing in your ears? Okay. Do you wear glasses or contacts?
I don't.
When was your last eye exam?
Last month.
And you don't require any corrective lenses? Everything was good with that, okay? Any history of asthma, bronchitis, or pneumonia?
No.
All right. Do you have any history of heart disease, hypertension, cholesterol, any AFib, or congestive heart failure?
No, ma'am.
All right. Do you have a history of atherosclerosis, vascular disease, or poor blood circulation?
No.
Okay. I know you said that you had GERD earlier, and that's why you're taking the Protonics. Any history of GI problems like ulcers or gastritis?
No.
Okay. Do you have any history of UTIs, STDs, or STIs?
No.
Are you sexually active?
Yes.
How old are you?
40.
You know at 40 you're supposed to start getting your prostate screens done annually. Do you do the testicular self-examination?
I don't.
That's something you probably should start doing. We can give you some information on how to do that monthly. We'll be glad to provide that to you. Do you have any joint pain, arthritis, sprains, or strains?
I don't.
Any neurological illness, seizures, epilepsy, mental illness, or MS?
No, ma'am.
Okay. Any blood-related illnesses, anemia, or bleeding?
No.
Any history of hyperthyroid or hypothyroid diagnosis or diabetes?
No.
All right. How do you feel about your overall self-esteem?
Pretty good.
Okay. Do you exercise regularly?
I don't.
I know you said you didn't get enough sleep. That's my next question. And are you eating well?
No.
Okay. How many meals do you eat in a day?
3 meals with a lot of snacks.
Okay. And are you a vegetarian?
I'm not.
You're not. Okay. And what does a typical meal look like for you?
Meat and potatoes.
You're a
pretty
meat and
much.
potatoes guy. Okay. Do you live alone or do you live with a family?
I have a family.
Okay. Do you have good family support?
I do.
Would you consider yourself to be spiritual or religious?
Yes.
Okay. Do you have a lot of stress in your life?
A little bit.
How do you usually manage that stress?
Through prayer.
Okay. So that's some of your coping strategies.
That's right.
Is your stress school related, work related, just life?
It's work-related life in general.
Okay. Any history of smoking cigarettes or marijuana?
Yes.
You smoke cigarettes or marijuana?
Cigarettes.
Okay. And how often do you smoke?
Every few days or so.
Okay. Well, you know that smoking is bad for your health and it can increase your risk of lots of diseases, cardiovascular disease and heart disease and things like that. So we'll be glad to get you some information to help you quit smoking. If you'd like to, we can provide you with some information on that. If it's something that you're looking forward to doing. Do you drink any alcohol?
I don't.
Okay. Do you take any street drugs such as methamphetamines, heroin, or cocaine?
No.
All right. Do you think that you've had any environmental hazards in your community?
No.
All right. Any intimate partner violence?
No.
Okay. Do you work?
I do.
Do you have any job-related hazards?
I do.
What are those?
You could possibly fall off a scaffolding or work around radiation, so there's that too.
Okay, so you do have some job hazards. Well, based on your assessment, I believe that you probably need to get more exercise. I know you didn't. You said you didn't get a lot of exercise. You should exercise 2 or 3 times a week, even if it's just walking for up to an hour. It's really good for cardiovascular health and overall health. And also, you may want to incorporate some more fresh fruits and vegetables into your diet. And we have some information. We can get you some meal plans if you'd like, so that we can get you some healthy eating, and also some smoking cessation materials if you would like those as well.
Okay.
All right, and I appreciate you coming in today. Do you have any questions for me?
No, ma'am.
All right, thank you so much.
Thank you.